is, you're not diagnosing, your job is to keep them safe from whatever the heck's going on with them, and to report back so that it is going to be, they'll be able to figure out what's wrong and not have additional. We don't want to have them chew off their tongue or damage. We're gonna worry about cyanosis? No, not unless they stay that way after they have gone into the post-ictal. That's something different. You expect them, because of the high energy a seizure causes, when a general seizure causes, etc., to burn off a significant amount of calories and not have good aeration, etc. But it's going to go away, and you have to be sure you let the family know. If it doesn't go away, then that's a whole different problem. So we are looking at them after a seizure. Did they manage to bite their tongue or inside of their cheeks? Once they start having that seizure, you can't put things in their mouth. You can put something in the front very quickly, something soft, just to keep the teeth from coming down and causing damage. Never put anything hard in anybody's mouth, the seizure. It's soft, it's just something there to keep the teeth from coming down on soft tissue. You want to look at how are they breathing. It's always nice to make sure they are breathing. You know, how abnormal is it? During the ictal, the seizure, they're going to have apnea. It's going to be there. So we're looking at afterwards. You know, abnormal breath sounds going on. Did they aspirate? Vomit and aspirate somewhere during the seizure. So you're doing just your basic assessment, real fast assessment to see, are they safe? Was there damage that occurred? They didn't have a tongue, they weren't bleeding from the mouth, they didn't have prior to, they hopefully aren't having it there. Airway occlusion. If they were doing it while having a meal, okay, there's something to worry about there, but you can't clear an airway while they're having the seizure. That just doesn't work. So you're checking everything. What is their consciousness afterwards? In the post-ictal, they're sleepy, they're irritated, they want to be left alone. Itself, they have no memory of what has occurred. You want to check them for, check their underwear. They also have lost control of particularly their bladder. So you always are checking the underwear also. Cleaning them up and making them safe there. And if there was any, at the end of a grand mal, maybe there's still some twitching going on. You're looking and you are documenting all of this. So get your assessment skills, your ability to see, recognize, document. You don't have to give the proper term to it, but you want to know that left arm was still twitching away while they were sitting there staring at it, whatever the case may be. While eating, had a seizure, airway cleared, no abnormal sounds heard, etc. Okay, make sense? Okay. That's it. Everything is there. We're going for the safety. And then we're the family, teaching the family that as time moves on, if the child has active seizure history, they know what to do. But those first few times, they're devastated, rightly so. They have to take, the child has to take the meds. They don't adjust without the physician. Sometimes they want, I'll give them a bit more, no. Particularly with some of the meds that are there, no. Any questions, they have to go back to physician in charge. Making those appointments. Well, they haven't had any problem. They seem to be good. They still need to come in and get that lab work done, particularly if they're on anything in the Tegretol family, things that'll go and destroy bone marrow. Looking for any additional activity. Remember, can't say remember you haven't had it yet. You'll have second hand. Some of those drugs also have, will cause other irregular motor activity, tardive dyskinesia. There's a commercial that's now on that talks about it. I noticed that the side of my face was twitching. I wonder what that was. Well, she also says I'm on mental health drugs. Well known to cause all kinds of other problems. Got to go ahead and have that reported. So if they see anything else new and different, because tardive dyskinesia is not fixable. Once they have it, they will have that twitching and other abnormal motor things for the rest of their lives. So emergency management, emotional support, probably should move that to the top of the list. Medical alert bracelets, they have to have something on them. Bracelet, necklace, something, so that others will know how to appropriately treat. And then there are plenty of agencies and organizations that are out there to support the family and the individual in their quest to live as normal a life as possible. Bless you. All right, so seizures. Okay, other things that are going to, let me go back to this, the medication, missing a dose of meds. They have to be careful about that. If they didn't take the med when they're supposed to, they need to take it as soon as they can, and then start the cycle from that moment. So they're taking it at 6 and 12, and they miss the 12, and they take it at 2. Then they take it at 2 and do the next 6 hours after that. So they have to reschedule it and work their way around to whatever works for them to make up. But they can't take an overdose, so we certainly don't want them to underdose. So within that 24 hours, so they need to get in their doses within that 24 hour, but not stack them on top of each other. Bless you. So if they miss their 12 and they say, well, the next one's at 6, I'll give them 2 doses. No. So they gotta be careful with those meds. Sometimes they get a little carried away. The emotional, really get emotional support. Don't forget, with teenagers, it's really also, remember, teenagers, image, multiple things with that. Anyone with seizures not under control for at least a year cannot drive. Teenagers are not pleased to hear that. So, we have to show that they are seizure free, which means they need a note from their physician. So, those are other things that consider. Depends on the state, but here in Texas, I think it's a year. Again, looking at infectious diseases, things that come down with aseptic meningitis is not infectious, but it's a problem. Okay, bacterial meningitis, that's the one we worry about a great deal. And we see it in the young kids. Aseptic meningitis, I already mentioned, there is no bacteria, no virus, etc., but it's meningitis just means inflammation of meninges. So loose blood flooding through there is inflammatory. Encephalitis, deadly, summertime in St. Louis, and then Reye syndrome. So talk a bit about any of these. Okay, bacterial. You see this in kids, why? Because it's usually secondary to already upper respiratory in their ears infections. Lots of ear infections. Serious, and in kids will lead to brain damage, nerve damage, hearing loss, and death, to put it mildly. It's usually a rapid assessment that is done when a child is brought in to the emergency room. They are going to do that lumbar puncture, get a sample and do a real fast check and see what was going on, and a few other things that they look at. In newborns, young children, usually what is seen as a group B staphylococcal infection is very common in them, and gram-negative bacilli usually enter them. So two major things, one positive, one negative. Either way, we see it a lot in newborns, and that's usually when we see most of our meningitis. That will occur in winter and early spring. That seems to be the most common time that they come in. So with these kids coming in, call an emergency because they fall apart rapidly. It takes less than 24 hours for them to be almost at death's door. It's itself. So the sooner they come in and diagnosed, the sooner treatment can begin with it. Infants are kind of hard to do because they never show anything that's normal itself. So what kind of symptoms do you think an infant may present that would clue the parent, I need to take this child in? Something's not right. What type of symptoms? Vomiting, not so much. The infants, they may burp it up a lot, but not outright vomiting.
Irritability.
Crying, give me a little bit more about crying.
High pitched crying.
A lot of crying? Like infants, so if they have a fever, remember, they really don't show. No, you missed something. If you bring them in, they're already unconscious. You really have all of us need on now crying.
Or feeding?
Feeding. No, we're not, that's not Bolcho's spot nails quite yet, but it's possible. First thing they're gonna do is stop eating. You know, when in doubt, pick poor feeding. Okay? They just don't feed, they put a bottle in their mouth and they're like, yeah, that's interesting. They don't suck on it. So that's usually the first clue on any young child, an infant, is they won't take to the bottle, they won't take to the breast, they just can't. They can't, poor feeding. The cry, it's not a hearty cry, it's a weak cry, it's a whimpering, it's a little whimpering just about for that. They look, if you manage to get any food in them, yes, they are going to vomit, so that's okay. And what about the level of consciousness? Oh, they certainly are. Definite lethargy about them. That is usually one of subtle. When we put them together, it's like, yeah, they look sick, but it may not start out that way. You know, he just didn't do well. You know, the bottle, and he took a little bit of his formula, and he's just whimpering. You know, he must be tired. Say fever. They really don't have temp control to begin with. So they may have a little bit of a fever, but not much or enough to get one's attention itself. So anything that is out of the ordinary, we highly recommend that they are brought in and to be checked out. Okay, by the time we get down to the rest of this, they are really showing. That positioning, we see it. Now, these are kids that, usually a little, not so much infants, they hurt so much, their neck and all, that they are bent. They literally have like their head and their heels on the bed, and the rest of them is off the bed. That's your opistotonic, there it is, position. Hyperextended to relieve, they arch, so. It's a definite attention getter when you say, I don't have to go any further. You have meningitis. We don't expect to see that, but that's the only way they can relieve that swelling and the feeling of discomfort along the spinal cord itself. Okay, Kernicks and Brzezinski's, those are the other fun ones. Where you bend their head, an older child bend their head, it's going to move their legs. They cannot tolerate having their hips flexed or their neck bent. Looking for a rash. Also, a rash, petechial, visceral, any vesicular, macro. A rash is kind of scares us because it speaks to a particular type of bacterial infection that is highly contagious and deadly itself. So that rash is usually indicative of Neisseria meningitis or meningococcal meningitis. Both of them are deadly. So seeing a rash, which usually shows up along the back, but some can move forward, is a terrible sign coming in. Not feeling well with a rash. Ooh. That child instantly goes into isolation. So, seeing what these children are, getting the history of, ear was bothering them, not eating, kind of funny shape. I lay them down and arching back, terrible. So getting that, so what is needed, first, there's fever, the older kids will come in, just, your toddlers, preschoolers will come in with a burning fever. So getting that fever down and avoiding shivering. Why? Now, some of you I just had on Monday and talked about shivering.
They burn thermal calories when they're suffering.
What is it until, yeah, there's 10 of you. Shivering.
Muscles tense up.
Do they burn calories? Do they shit?
Same thing with adults. What's the problem when you see somebody shivering? They're spiking a fever. And what are you gonna do about it when you see shivering? You uncover them. Do not tuck it. Oh, they're cold. No.
No, you uncover.
You uncover them. You uncover them. Everybody wants, I'm cold. You're cold because you're only sitting at 100 and your body wants you at 103. No. So what are you going to do to help with the shivering? Oh, you're going high tech on me, okay. What are you going to do when you said avoid shivering? So how are you going to decrease? The minute I see you shivering, you're going to take the blankets off. That works for me. You'll leave them with something. If the older child, I still remember hanging onto my blanket and I was practically stewing in my juices every time. Cool them down. Okay, start with a wash. You can go in some cool things. One thing you want to tell parents is if they're at home, do not ice them down. No icing. No, that makes things actually worse. And also, alcohol is very cooling. As an adult, we cannot put alcohol on a baby's skin or a young child's skin. Why? Because they absorb it and alcohol. It's not that they're going to become tipsy because that alcohol is rather toxic. But no alcohol is to be used for that, its cooling purposes on an infant. Just tap water. Yeah, no icing. At one point, we used to do ice water and pour alcohol in. I don't know how any generation survived that one. Look back at what used to be done. Nobody knew that at the time. But I distinctly remember, and that alone made me get out of bed. There she comes with a bucket of ice. No, I'm good, Mom. All right, so avoid the shivering. If you see it starting, you're certainly going to find out what is your antipyretic medication that has been ordered, yes, and the antibiotics and everything else. But you've got to go ahead, get the fever down, and keep them from starting to shiver because you're going to start losing the battle if they get into the shiver. It becomes far more difficult to get that temperature down. Okay, droplet isolation until the antibiotics have been on board for 24 hours. So they go into isolation, droplet isolation, until proven otherwise, even if it's aseptic meningitis or viral meningitis. We don't know. They go immediately into isolation, and certainly if it's bacterial, they have to be on their meds for 24 hours before they come out of isolation. At least 24. Sometimes we just keep it a bit longer for safety, and that's important to tell the parents that, particularly when they want to bring the other kids in, see their sibling. No. Okay, the other precaution, different things, is the vaccine that's out already that starts at 2 months, but that doesn't do great protection. That's the Haemophilus influenza B. That's the abbreviation for vaccine. The meningococcal vaccine doesn't start until they're starting their teens, etc. And it is mandatory that every university plus, etc., anyone living in the dorms have to come in showing that they've had the vaccine. That's another very popular commercial, frequent commercial that's on now. You send them off to college and they come down. It will kill a teenage or a college freshman within 24 hours if they come down with the meningococcal meningitis. By the time they make it over to the school infirmary, they're, it's late. So they're important vaccines because those particular types of meningitis are just outright deadly. Okay, the aseptic, already mentioned, they treat it until they find out that there wasn't anything really growing, etc. It's self-limiting. They'll be uncomfortable for a week, almost into 2 weeks. But if it's aseptic, then they can be discharged, they can go home, they're not gonna infect anybody, etc. But the child or the adult also will be uncomfortable for a while with that until the inflammation of the meninges goes down. They can take some aspirin and Tylenol, just to help with their local discomfort, but it's no real treatment for aseptic. Encephalitis. Most of them are viral. This is the one that we see in the summertime with the mosquito population. About the mosquitoes carrying the St. Louis virus, etc. The thing is, you're talking about encephalitis, you're literally talking about your brain itself being on fire. So they're going to go ahead, they want to see if it's actually the brain itself that is problem, or is it part of the meninges, or just the meningeal inflammation. So they have to do the diagnostics. Recovery, few days, or maybe complicated, yes. Encephalitis is very complicated because we're talking about the brain being literally on fire. And the only treatment for it, since it is mostly viral, is just supportive. There's no antibiotic or magic that can be given. So, basic problems with the brain being so inflamed is perfusion within the brain can become problematic. So, always checking and looking at whatever's going to help that brain with its blood supply. Hydration and nutrition, and then injury. Usually there are seizures that will go along with encephalitis. So it's particularly something nobody ever wants to see itself. Okay, dry syndrome, call it neuro, it actually involves the liver. What had been discovered was that in the face of a viral infection, the use of any salicylate would cause essentially the liver to start to fail in some of its functions. That liver failure with the ammonia, the brain can't stand ammonia. Literally the brain would start to swell itself. So now they are having increased intracranial pressure, and there's nothing that can really be done about it because the brain is now encased in the head. So we see this with kids who fontanelles are closed and the suture lines are closed at the head, expanding. And because of the brain swelling, death was imminent, unless they could do something about it. So the two-prong approach is certainly trying to work with the liver and get those enzymes down, but then to control the brain swelling, which is immense. Last time I worked with a child with it, they were using the Canadian approach. Canada was removing the top of the skull to allow the brain to swell. And that's the last child I took care of at the Children's Hospital I was working at the time before I moved. Thank you for this good going away. Literally. So they do crack the skull in order to allow that brain to expand, because there's nothing can be done to keep it from expanding. One thing that is done is no aspirin, no aspirin, no aspirin for anyone under the age of 12 at least. Because it's a viral infection, it seems harmless enough, but the reaction that an individual has. They used to have something out called St. Joseph's baby aspirin. Now they just call it St. Joseph's aspirin. The baby part was the fact that it was 81 milligrams, but people were giving it to babies. And it took quite a while before it was connected point is, why do we have these, what is going on? So that company took a real hit on people using that stuff. No one knew. Pepto-Bismol. The adult variety has, because they now have children variety, adult variety has salicylate in it. Got an upset tummy, could be viral. Have some Pepto-Bismol. So, we have to be careful with what's going on and make sure we inform the public, take the kids in. Treating just because it worked in your day isn't working here, etc. So the nursing assessment, basically everything with these children. Signs, if the brain is swelling, that means they're going to have all kinds of neurologic complications. So it's noting what's going on with it. These kids go directly to ICU. Usually have to be ventilated. Not usually, they have to be ventilated. And a number of things, so don't stand, but it's just the teaching of population on the appropriateness of what is going on with any child. And say, oh, I think he has a little bit of a cold and a temper. Can we have baby aspirin? Because people still ask for it. No, not happening. And then the confirmation with the liver that shows the elevated ammonia, that it cannot convert, and the fact that ammonia in the brain do not work. Okay, we have trauma. Trauma is a rather broad term that includes specific patterns of injury itself. So when we are looking at children coming in that have had head trauma, there's a lot of questions that are asked. You all know about what you see in the news. Oh, the baby fell off the bed and hit his head. And we can tell the difference. No. So fractures, okay, that's breaking of the bones. Baby's head does not fracture, rolling off and hitting the floor, or the rug, or whatever. It's got to take a lot of trauma. Remember, it's pliable. A concussion is the brain being shocked. If any of you have had a concussion, you maybe in an automobile accident or got hit in the head accidentally, etc., a moment of loss of consciousness, the brain does some swelling, there are neurologic things that will show up for, but they're temporary. Older children with a concussion, there are kind of a syndrome that follows it, where they may have headaches and other signs that the brain is trying to pull itself back together again, and that can last from a few hours to a week. Usually if they go into emergency with it, they'll give you the paper that speaks to concussion and what to suspect. It's not unusual for a concussion to happen. The child running along and turned around, wasn't watching, and ran smack into a wall head first. It happens. Contusion, contusions is tearing of the tissue. The brain doesn't handle that well at all, and they will show something on the outside, etc. Your subdural and epidural hematomas. Okay, what are the layers of the meninges? You don't pay too much attention to because it's almost translucent and directly stuck to brain tissue. But those others, it's not so much we play around or worry about the meningeal layer, it's the space between them. So an epidural leading above the space above the door itself. Subdural, space below the dura but above the arachnoid, and subarachnoid. Those bleeds cause a tremendous amount of problems. Just put up subdural because it's slow, usually a venous. It can collect over time. It may be big, it may be small. Epidurals tend to be horrific ones. They're fast bleeders, usually arterial. And the most common spot where they're going to occur is usually where it's the thinnest, most over the temporal area itself is one of the thinner areas of bone. And and where an epidural can occur. And if not caught within a few hours, the individual dies. Usually people say, that's why people have a concussion and they always want to keep them awake. Now just watch them and keep them awake, see what they're like. They're worried about an epidural that may be occurring because it's rapid loss of consciousness and really hard to control that bleed and save their lives. So we're looking for any head injury in a child. Accidents do occur, but unfortunately some of them weren't exactly accidental, that a child would have a head injury. So look at Granny. Non-accidental. Full appearance of neuro can take several years. So, and head trauma it'll be years before we see the total damage that has occurred in itself. Say, it can happen. It wasn't meant to happen, but high index of suspicion, and when in doubt, CPS will always be called. Okay, and then near drowning. Talk about that. It's summertime, and we've already had far too many here in Houston. Near drownings. Okay, two different things. There's near drowning and drowning. You don't see drowning at the hospital because they're pronounced right then and there. Near drowning, there was some resuscitation and they brought them in itself. Who do we see with near drowning? Toddlers. They can't do what you want them to do, but they sure can get over that gate into the pool, through the fence, over whatever. My mother talked about how I always escaped our fully fenced backyard. They put me in the backyard and they find me running in the front of the house, down the street, and chasing. They found out later, I take my little tricycle and I stand on top of it, I reach over, unlatch the gate, pull the tricycle immediately through, then I turn around and laugh. She said, you never learned how to pick anything else up, but you learned how to do that. Yeah, me and the tricycle off into the wind. So, and then adolescent males, yes, I'm sorry guys, you are more likely to drown besides us. We don't like to get uncute. Okay, submersion, injury, survival for 24 hours, consider it near drowning. What is the problem with it? Okay, it's the fact you're cut off from oxygen. The water, yeah, it cuts you off, but it's the oxygen. If you can be oxygenated to the brain, etc., survival can be better. Now, the tissue, the brain has become hypoxic along there, so there can be additional damage that occurs from it. It's not the water in the lungs, it's the fact that oxygen is not getting to the brain. That is what it causes damage itself. So chronic neurologic damage is there. So common symptoms of near drowning: oxygen deprivation, the retention of carbon dioxide, VCO2 itself, and then there can be direct damage to the lungs. So they have a lot of near drowning. Now, near drowning also is different in warm climates and cold climates. In cold climates, your brain will survive a little bit better. Because there was a movie that came out and spoke to it not too long ago. In cold climates, cold drowning, cold water drownings, temperature must be brought up to body. Your body temperature must be brought up to normal before you can be pronounced. Down here, you still stay pretty warm, so the pronunciation of death will come sooner. But in cold, we have to get your body temperature up before they can say you're dead. Okay, so it's handled different parts of the country and what's going on. First year I was down here working pediatrics, I couldn't believe the number of drownings coming into the ICU I was working. Unbelievable. So teaching, and watching. Kids need to learn how to at least float. And everyone keep an eye on those little toddlers. Okay, blood flow disruption, yes, children have strokes, and they're not all ones with, sickle cell. They can have strokes because of the connection, the malformation, the AV malformation, in the brain itself, so there are cardiac, and the intercardiac defects will do it, coagulation, features that will also go ahead, genetics, so they can have strokes, so we're still watching them carefully. Aneurysms, any number of things, so disruptions of anything to the brain, they're gonna have a stroke just like an adult has a stroke. The only thing about kids having stroke is that their brain is still growing, still maturing, so they're going to have a better chance on rehab itself, where they will go back and rehab the brain retrain. So the younger they are, the better rehabilitation will occur for them. Okay, these neuro dysfunctions, what time is it? 10:48?
Yes.
Okay, the spina bifida comes in varieties. Occulta means hidden. So you're looking at the vertebral column coming down. And we got the lamina that's there, it's protecting the spinal cord and different things. But sometimes part of the bone is missing on the spinal cord. So if it's missing, that means the spinal cord is kind of free to escape. And part of it does come out of its bony protected area. And now we can have a whole spinal cord sitting out there or bulging out into unprotected area, occulta. So a hole in the spinal cord itself, a defect that's there, can be benign and asymptomatic, or it can be devastating. So when babies are born, we're looking at their back. See where it says dimpling. Dimple is actually a hole in breaking the continuity of the surface of the skin, be it in the muscle or otherwise. So we're looking down the back and we see people say, oh, he has a dimple. Well, you have every nurse going, dimple? No, we don't dimple back there. Okay, abnormal patches of skin. That speaks to something else that is not supposed to really be there. Or the site is discolored. So when babies, we look at them and we look down the back and feel down the back, etc. going on. And it can be, particularly with occulta, nothing actually happens. There's no adverse effect. These are the beginning of the adverse. A meningoceal. Anytime you see seal, that means it's pouching. So your meninges are pouching out. So they're herniating through that defect. So you have this, it's coming down and then just an opening. Well, I'll just take a little detour, take a peek out there, and the rest in. So we see the visible sac. Now it can be covered with skin, or worse, with the other one I'll talk about, it's not covered. You literally are looking at the internal part of your spinal cord sitting out, looking you back in the face. The one thing is, if it's covered with skin, okay, it's safe. It's not at least going to get contaminated. And they're going to do what they can to kind of put it back where it belongs, because as long as it's sitting out there,